Hello, dear viewers. It's always a delight knowing that you are always there on this program and on this station, Everything Catholic, as we continue our journey towards understanding everything about the Catholic Church. I remain always your anchor priest and brother, Reverend Father Boniface Nebo, and of course, in my usual company,
Father Silvanus. Amen. Welcome to the program this week.
Thank you. Today we continue our discussions on the various commissions of the Catholic Archdiocese of Abuja, Nigeria. And today we are focusing on the Health Commission. We have with us three guests. The first is the chairman of the commission. We have the secretary of the commission as well as a member of that same commission. Dr. Matthew Ashikede is the chairman of the Health Commission and the president of the National Association of Catholic Doctors. Doctor, we're glad to have you.
It's a great pleasure.
So thank you for being with us.
Thank you very much.
Welcome to the program.
And good day, viewers.
So we also have with us Dr. Mrs. Tessie Nwachukwu, who is the secretary of the Health Commission, Catholic Archdiocese of Abuja, Nigeria. Doctor, we're glad to have you. Thank you so much.
Thank you for having me.
Welcome, Doctor.
Thank you.
And of course, last but not the least, we have very Reverend Sister Dr. Cecilia Azu, MMM, the health coordinator of the Catholic Archdiocese of Abuja, Nigeria, as well as a member of the same commission. Sister, thank you for being with us.
Thank you, Father.
Welcome, Sister.
Thanks.
So, dear viewers, we begin our discussion, and Dr. Ashikede Matthew will want to begin by introducing us to the Health Commission. Yes.
Thank you very much, Father. The Health Commission, as you all know, was constituted by His Grace, the Archbishop of Abuja, His Grace, Dr. Ignatius Kaigama, last year, 2020, around September, along with several other health commissions in the Archdiocese. We have the responsibility of ensuring that the Catholic health institutions in the Archdiocese provide quality services in line with extant guidelines and policies. We also are charged with the responsibility of ensuring that health workers in the Archdiocese participate actively in providing good quality care to parishioners and the public at large. And this we do by making sure that there is a good working relationship amongst the different professionals in the health team, as well as the management of the Catholic health institutions in the Archdiocese. And we also make sure that we not only meet regularly to discuss issues that are of common importance, but we also hold conferences with our professional associations and different groups so that we can help to build capacity of our colleagues in terms of contemporary health issues, and then the best ways of interacting with parishioners to ensure that their spiritual needs as well as their health needs are provided for.
Okay. Thank you very much. Doctor, of course, it's over a year. Your commission has begun work already, and one of the very primary tasks of this commission, the Health Commission, is making available and accessible quality health care services. So in what way, or what are the plans of this commission to make sure this gets to the grassroots within the walls of the Archdiocese?
Thank you so much, Father. Making sure that health services get to people at the grassroots, definitely, like you said, is one of our core mandates, some of the things that we are supposed to do. And what we have done so far has been to analyze the health facilities that belong to the Catholic Archdiocese of Abuja. So at least have a clear idea of how many of these facilities we have, where are they located, what is the source, what are the human resources available in those places? Do they have doctors, do they have nurses, pharmacists, or pharmacy technicians? So these are the things, basically taking a clear picture, having a snapshot and clear about the resources really available to us. And we've done that. And what we have found out is is that we really do have some bit of challenges in terms of human resources. So we need to, like my chairman said, one of the things is how are health workers involved in the health systems of the Catholic Archdiocese of Abuja. And it seems like there's a lot that we need to do in those areas. We need to drive more people, because without the human resource, you cannot deliver services. So those are some of the things we've done. We've noticed that some of our systems are kind of a little bit run down, so we are having meetings with those facilities to see where are the gaps. And like what has happened in the Pro-Cathedral facility there, of course they had challenges, inability to keep that system running. If it doesn't run, it can't provide services. So those are the things that we have been working on. And we've worked with Pro-Cathedral, we've worked with the hospitals in Abaji, we've worked with the health facility in Gwagwalada to kind of brainstorm with them the operational challenges and how we can support them to take the system down. Yes. Thank you.
Sister, let me direct my question to you. You know, man is a composite of body and spirit, body and soul, if you like. And you are of the medical missionaries of Mary. Yes. When Father introduced you, he said,
well, that is the meaning of MMM.
not the Ponzi MMM, but the MMM meaning medical missionaries of Mary. Yes. And through the health institutions of the church, she brings the healing ministry of Christ to the people. Jesus did not only minister to the spirit of the people, he also, to their souls, he also ministered to their bodies. And that's why he went about healing the sick and even feeding the hungry. Now, in this commission, this health commission, what are you doing to ensure that this ministry of the church, this ministry of Christ in the church is not trivialized?
Thank you, Father. You know, like Chairman,
We need to be audible.
We're working to ensure that there's a holistic approach to the health services that we're giving.
Okay.
So that we, as much as wanting to touch their bodies and souls, we are also having before our eyes and working towards respecting the human person.
Good.
So, as I supervise the institutions, we have 10 institutions in the Archdiocese.
Okay.
And we're covering all the local area councils of the Archdiocese, and the institutions are on their feet, you know, making sure that they're providing what's needed without compromising the services or the quality of what they're offering to the people. And of course, we're open to everybody, irrespective of their religion or wherever they come from. And a lot of the institutions have upgraded. They're all secondary institutions,
okay,
except one by the Medical Missions of Mary, that's only primary health care. All the others are secondary health institutions. The new place that the Daughters of Charity have in Kubwa, it's a 100-bedded hospital, and it's huge, and they're providing all kinds of services. So we are doing our best with what's available without compromising standards.
Okay. All right. So, thank you very much. I'll come to you again, Dr. Matthew. While Dr. Teresa was talking earlier, she already talked about one of the challenges of the Commission, which is mobilization of personnel, human resource, and all of that. So, what more challenges, so far so good, has this Commission got to deal with, and how have you been able to manage them as well? Okay. And how can we come in to help, especially viewers?
Well, if you look at the scope of the work that the Health Commission has to undertake, it involves moving from one place to the other. The health institutions in the Archdiocese are scattered around the FCT. And you can imagine we have St. Peter's in Abaji, right? We have the one in Kubwa, the Essential Hospital. We have some in Buhari itself. Yeah. And then some Gwagwalada, so scattered all over the FCT. So if you really want to address them effectively, you must have effective and efficient means of reaching out, mobility. Not just communicating by phone. You need to visit,
monitor and supervise.
Yeah, monitor them, supervise them, encourage them by sitting down with them, and that requires some degree of funding. We are well, I would say self-sustaining to an extent. We rely on mostly from benefactors, our friends, and well-meaning members of the church, with very good support from His Grace, who has given us a lot of goodwill, a lot of support. He sent us out to do this work and has really been very supportive. So there's no budget line for the Health Commission, just like every other commission. But we have been able to work within the available resources to be able to interface with all these institutions as well as with our colleagues around the Archdiocese. So I would say funding is a key challenge. If we had a budget, maybe adequate funds, we would have been able to do much more than what we are doing. Because apart from visiting these health institutions, we also interface with the parishes and pastoral areas, providing services, outreach services, collaborating with other colleagues, the Catholic doctors, the Guild of Nurses, Catholic nurses, the pharmacists, to provide outreach services and reaching out to a large number of people, 200, 250, 500 people, in different locations, to make sure that we provide care that will bridge the gap between what is available in the health institutions, whether public, government, or the Catholic mission. But still, we do all this. So funding will adequately help us to do much.
Thank you very much, Doctor. Dear viewers, we're going to leave it here for now as we continue our discussion with the chairman, the secretary, and a member of the Health Commission here with us. Go nowhere. It is still Everything Catholic.
Everything Catholic, a program that discusses anything and everything about the Catholic Church. Faith, doctrines, morals, canon law, church governance, papal documents, you name it. As long as it is Catholic, it shall be discussed. Join Father Ahmed Silvanus and Father Nebo Boniface, two priests passionate about teaching the true faith of the Catholic Church, as their hosts bishops, priests, religious and distinguished laymen and women, to discuss and simplify the wealth of the Church's teachings. Everything Catholic, showing on Catholic television, CTV. Everything Catholic, teaching the faith.
Welcome back, dear viewers. We continue our discussion on Everything Catholic. Before we proceeded on that very short break, we were talking about the various challenges of this commission, the Health Commission. And we continue with our discussion as Dr. Teresa Nwachukwu will pick up to tell us what plans this commission is having to bring to context and localize their activities to the parish level and even down to the grassroots of the Archdiocese.
Thank you so much, Father Nebo. What we have done and what we continue to do is to encourage every parish, every outstation or pastoral center to have a committee that is implementing some form of health services and information-giving services to the people. Imagine if every parish had a health committee. During the strike, you'll be able to give services to the people. So that's what we've done, and most parishes do have something, but they need to be more active. I know that Maitama has a very vibrant health committee. They do outreaches all the time, and they do services almost, I think, on a weekly basis. And some other parishes also have an inherent committee, health committee in their parishes. So that's what we've done. And we're expecting, we're hoping, and we're working towards encouraging every committee. During the General Assembly, there was that question, why can't we have a health commission at the parish level? And my thought was, we can't have several health commissions. We have only one health commission, but every parish should have a health committee.
Subsumed in the commission.
Absolutely. And then you can give information about health services or health conditions in your bulletin, in the Good Shepherd newspaper. There's so much we as health workers can do if we bind together, if we form these teams and these committees to serve our people. So we really encourage every parish out there, even if it's one person, start something, get a colleague together and begin to meet. And as you do that and you begin to offer services, information, people will join you and the committee will expand and it can do much more.
Oh, very
Thank
beautiful.
Yeah, Dr. Ashikemi, you are the, excuse me, the president of the National Association of Catholic Doctors. And at all levels, national, state, and local levels, we have Catholic doctors. You are Catholic doctors at the state level and you are volunteering to serve on this commission. But I'd like to ask, as a commission, how much level of engagement are you having with these kind of bodies to ensure collaboration, to push further the objectives of your commission?
Thank you very much. There's been a lot of activities surrounding the health professionals, especially the doctors, which I lead as a national president. Most of the conferences held by these associations are well attended by our members. The last conference of the Catholic doctors was held here in July in Abuja, and we had all our members present. We also had visiting colleagues from within and outside Nigeria who participated, even though it was a hybrid, virtual and both physical and virtual, and because of the times we are now. But participation was very, very, very active and rich, and we were able to rub minds with our colleagues and our sister professionals. The nurses were there too. Sister mobilized a lot of the nurses who came, and we are members and part and parcel of the team. And together, we worked as a team to take healthcare to rural parishes. Okay, we are at Gishiri, right, and provided quality healthcare, comprehensive services, both laboratory investigations, preventive care, vaccinations, as well as therapy, providing services for those who are ill. And that we did at a rural, Gishiri is a rural pastoral area.
Yeah.
We reached out to well over 500 people.
Wow, that's massive.
All right. And then we've also had situations whereby working together as a team, we marked certain landmark health activities like the World Health Day, which is held every year, April 7th. That was marked at Our Lady Queen of Nigeria, where we attended to well over 250 parishioners. His Grace was there, and members of the commissions were there, Chief Kenta was there, and we worked together as a team, providing holistic and comprehensive services. And that way, that's how the health team works. It's not just about a particular professional group. Okay. We have worked across all the professional groups to provide that holistic and comprehensive care. That is what we are promoting. Okay. Not just in Abuja, but across the nation, where we have our members, we encourage them to work with other professional groups so that they can attend to the health needs of our primary constituency, our parishioners. We start from there. And it's not limited to parishioners anyway. It's open to everybody. But of course, charity must start somewhere.
Yes, sure.
So we start at home in our parishes, and that way we are providing the health needs, giving them both preventive care and curative care. And that has been very useful, especially in these times where we have a lot of outbreaks, pandemics. COVID is still with us. Other pandemics, epidemics are coming up. Cholera outbreak, we just had it. Lassa fever is still there. All right? Yellow fever is still there. And as we don't know which one will come next, so we'll continue to provide these services, working together as a team for the general public and parishioners, so that they benefit from that.
Okay, thank you very much. Sister, I will have to have this discussion, this question. Maybe you begin from there, and if there are contributions from doctors, that will also pick up. One of the general concerns a friend shared with me, and even took it on social media, was that Catholic educational and medical facilities are expensive, and that they pay more to be in hospitals and to access medical services. And well, the simple clarification I gave was the fact that if the church has decided to take up the responsibility of the government as a private body, it will even be higher to maintain such bodies. So, what plans are in place to possibly subsidize the cost of accessing medical services in the Archdiocese, and possibly, applied anyway to wherever our viewers are listening to us from?
Well, the cost of maintaining health facilities and health facilities is colossal. So what we are experiencing in our Catholic health institutions is that a lot of people come because it's church, it's Catholic, it's trusted, service is given. There's no discrimination, irrespective of your age or status. So, when you go to our hospitals, you'll find out that there are a whole lot of bad debts. Why? Because people come, you can't reject them, because it's church and they know. So, I can speak on that because I know what the health institutions are going through with bad debts because they can't reject people. So, saying they're very expensive, I don't think they're more expensive than the others. Otherwise, the rest is the case. That's where they go. When people cannot go anywhere else, they go to the church.
That's right. That's true. Okay.
And if I just
yes,
please. All over the world, healthcare is very, very expensive.
Yeah.
You want to provide quality healthcare, you want to do investigations, you want to do comprehensive checks, you have to involve a lot of professionals, you have to pay their emoluments. So it's not cheap. The drugs are not cheap. You provide accommodation, everybody wants to be comfortable when he's in hospital, which is part of the therapy anyway.
Yes.
And all these things have to be provided for. You need power. 24 hours. You know that generator is the main power in our country. The national grid is now the alternate. Or it should have been the reverse. So
yes.
You provide this, provide water, you provide security. It's not cheap. But there's a way out.
Okay.
And the way out is health insurance. If you have a health insurance, you use the number of people who subscribe to subsidize for those lower down the column, so that it's subsidized for the poor by making sure a lot of people are contributing. So you have the pool of resources.
Principle of subsidiarity.
Exactly. So it becomes easier for those who do not have to get those quality services. And life is precious. Once it is lost, it is lost. So you can't say, okay, because this one cannot pay, you give him some standard care. No. You must maintain that standard. That's what His Grace wants us to maintain. That there is quality service in all our hospitals. Good. And then we make sure that we encourage people to take up health insurance so that they can afford it. If you have a health insurance, you only pay 10%. So if your bill is 10,000, you pay 1,000. So it makes it easier. A lot of people who are on health insurance will tell you, I was expecting to pay so much bill, and they gave me just a token, and they're happy. And what you need to subscribe is just a little token amount every month. So whether you're sick or not, you pay. All right? And then, of course, in those who earn more, pay more. But as it is, because the money is pooled, it is easier to provide quality services for everybody. And that's the way to go. No free services. If any service that is free, it will collapse. It's not sustainable, and nobody will advise that. Whether it is health, whether you're talking of education, or any service you are providing, it must be funded. So you find in innovative ways of funding health, and health insurance is the way to.
That's money.
I would like to take you to our parishes. You see, health emergencies can come up at any time. And a lot of times you see these kind of things happen even in parish. Maybe somebody collapses, an asthma patient, epileptic patient, and all of that. And then there's no one to attend to that person. As a commission now, what are you doing to ensure that such kind of emergency services are readily available in parishes? You may just respond to that very briefly.
All right, yes, very briefly. What Dr. Teresa mentioned about establishing health committees in our parishes, in our pastoral areas is key.
Okay.
So we have professionals in all these parishes. There's hardly any parish you go to, you don't find it. Right? I was speaking with the Chancellor the other day. He told me that he has a team in the upper ground. I was surprised. That's okay, let us have their details so that we have a network, proper network of communication between all the health committees in the different parishes and pastoral areas. And that way, we can coordinate our activities and make sure that at every Mass, somebody is there. You have a first aid box. When somebody needs attention, it's attended to. We have had it in the city, those parishes in the town, we have some. In Metama, which is my parish, we have a standing health committee, all right, supported by the parish, okay, that we have run a free clinic every week.
Saturday.
Exactly. And at the same time, we have a first aid box, so we know the members, all right, and we share ourselves into the different masses. So we are present at the mass. And then, of course, when it has happened several times, we had to rush, stabilize the case before taking to the general hospital. So it's very, very important, and I think that's what we are encouraging.
Thank you.
All the parish.
Thank you very sincerely, dear viewers. This is how much we can go for today. And thank you for always being there with us on everything.
Right. Action.
So thank you, dear viewers, for always being there. This is how much we can go for today. And we're wrapping up our discussion on the Health Commission. And this is a big thank you for being there, and even more to Dr. Matthew Ashikini, Dr. Teresa Wachuku, as well as Reverend Sister Dr. Cecilia Azu, MMM. Don't forget, MMM is not the Posey scale, but the medical missionaries of Mary. Please continue being with us. We'll see you next week, but don't forget to subscribe to our YouTube channel on the social media and follow us as well on all our platforms. Your supports and encouragements have kept this program going. Please keep your sponsorship coming as well as with your suggestions and recommendations. This is Reverend Father Boniface Nebo signing out. God bless you and see you next week.